Hi, I'm Lynn. I'm one of the staff development specialists in Sharpery Steely Training and Education, and I'm going to review with you the maintenance procedures for the Clinitek status urinalysis machine. At your site, you should have one of these posters by your machine that goes over the maintenance that is required after each test, each day, weekly, and monthly. After you've completed running the urinalysis test on a patient, you will have the test strip in the machine and it will print out your results. You throw this away and you want to have a moistened 2x2 to wipe off any excess urine on the test table. Throw that away and then have a dry 2x2 and dry the test table. This will remove any excess urine that the patients had left on this test table so it doesn't affect the next test for the next patient. At the end of each day, what you want to do is you want to turn off the machine with this power button, and you want to just take an alcohol swab and you want to clean off the screen here with the alcohol swab. This one will remove any excess urine from the screen. And then you want to have a soap moistened paper towel and just clean the outside of the machine, removing any urine that may have gotten on the machine during the day. You want to avoid getting any moisture inside the printing apparatus. Weekly, what we want to do is we want to pull the test table out of the machine, and you'll see that there's two pieces here, okay? You never want to touch this white bar here, okay? This is the calibration bar. This should never get dirty. If it is dirty, then there are special instructions in the manual on how to clean it, but we want to avoid touching this or getting it wet. So what we would do is we would get a cotton tip applicator, and if there's any crusted in urine here, we would want to remove that. And then what we want to do is we want to rinse both of these with water. So remember, we don't want to get this wet, so what I recommend is kind of holding your hand over it like that, rinsing here, and then you can rinse this little test table. And this is after you've cleaned it with a cotton tip applicator. And then we're just going to dry both pieces. Again, I haven't touched that white calibration bar, but I'm drying this area to remove any caked on urine, okay? And then I'm going to go ahead and place it back together like this, and gently I'm going to insert it back into the machine. You only want to push it halfway and stop. You don't want to push it all the way in, okay? You never want to clean the outside of the machine with any of the disinfectant wipes, just a lightly moistened paper towel with water and a little soap. Once a month, what you want to do is you want to soak this test table in a bleach solution. So a good container to use is one of these empty multi-sticks containers. It's the perfect size, and we've already made these labels that you can call Training and Education. We can send it to you if you don't have it. And it says a 1 to 20% bleach solution. Don't worry too much about the concentration because you could actually use a full strength bleach, but the minimum concentration is 1 to 20. So 1 part bleach to 20 parts water. But you can actually do full bleach, but the fumes would be a little stronger. So actually, like 1/4 water, 1 inch of bleach to 3 inches of water. So you have 4 inches of solution is perfect. And what you want to do is you prepare a fresh bleach solution. You remove the test table from the analyzer, and if there's any urine in there, you'd want to drain it. Okay, and we would do the cleaning that I just demonstrated with the Q-tip and then rinsing it off. Then we want to place the test table inside this 4 inches of bleach solution, and we soak it for 2 to 10 minutes, but no more than 10 minutes. After you've soaked it in the bleach solution, you can go ahead and drop this part in the bleach solution, and we're going to go ahead and rinse this again under the running water to get the bleach off it. Again, I'm protecting that white calibration bar with my hand, but I'm not touching it. Okay, and we're going to dry it off. Okay, so that does a good disinfecting of the test table. I'm going to go ahead and gently place that back in here. Then when my 2 minutes is up, I'm going to go ahead and remove this from the bleach solution. Again, I'm going to rinse the bleach off of here. I'm going to dry it off. And that is my monthly maintenance of the Clinitek Status Analyzer. Okay, and then I'm just go ahead and put that back in there. Okay, and while I have you here, I might as well show you that this part of the test table is reversible. This side will hold the test strip that I just demonstrated. If you turn it over, this is to hold the Clinitek HCG cartridge if you're doing a pregnancy test, and it would sit in the test table like that, and that will be another demonstration. Okay, so you just want to make sure you have the correct side up for whatever kind of testing you're doing in your department.